In this mini tutorial, we're going to create a very simple table summarising some major aspects of the cranial nerves. So this table is going to have initially a column which is going to detail the number of the cranial nerve which we are dealing with. So I'd hope that you recall that there are 12 cranial nerves in total, and the convention that we use is that we use Roman numerals to define these cranial nerves from 1 through 12. So that's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and finally 12. So these are the Roman numerals for our 12 cranial nerves. The second column that we're going to have is for the name of the cranial nerve. And the important thing to appreciate when it comes to naming the cranial nerves is that there's a great deal of information in that name. And I'll try to stress that to you for each of the specific nerves that we consider. The third column is going to provide us with a very basic summary of the function of that cranial nerve, and we are going to define whether that nerve contains sensory components, motor components, or autonomic components. And we'll be looking in more detail at the autonomic components of the cranial nerves at a later time, but I think it's important for you to realise that cranial nerves can have different mixtures of sensory, motor, and autonomic functions. The final column that we're going to include is one just containing some general notes. So if there is anything of additional relevance that we want to mention, we'll put it in there. So let's make a start. The first cranial nerve is known as the olfactory nerve. The olfactory nerve. And if you think about the word olfactory, it's related to olfaction, which is the sense of smell. So the olfactory nerve is the nerve responsible for the sense of smell, and it is solely a sensory nerve. So we'll just put an S in the third column. The olfactory nerve is a very interesting nerve for a number of reasons. For example, there is not just one olfactory nerve, there are actually many olfactory nerves all passing through the ethmoid bone on their way up to the cribriform plate in the anterior fossa of the skull. We know that the olfactory nerves are able to regenerate, which makes them a very interesting component of the central nervous system. And finally, an interesting clinical aside is that a head injury can lead to the loss of the sense of smell by effectively tearing the olfactory nerves away from the underlying nasal cavity. So that's a brief summary of the olfactory nerve. The second cranial nerve is the optic nerve, and this, as the name implies, optic, optician, optical, is the nerve responsible for the sense of sight or vision. So the optic nerve carries visual information and is once again, like the olfactory nerve, a purely sensory nerve. Each optic nerve contains about 1 million axons and they carry a huge amount of information. This is important given the fact that us humans are particularly visual creatures. The third cranial nerve is the oculomotor nerve, the oculomotor nerve. And if you break that name down, oculo refers to eye and motor refers to movement. So the oculomotor nerve is one of the nerves which supplies muscles responsible for eye movements. So that's important for eye movements. But in addition to this, the oculomotor nerve contains some autonomic fibres which are important in the control of the pupillary diameter and also the shape of the lens. So not only is the oculomotor nerve a motor nerve, it is also an autonomic nerve. Now, due to the fact that the oculomotor nerve only supplies a subset of the muscles which move the eye, if we have damage to the oculomotor nerve, this can lead to a very typical clinical sign where the eye is seen to look down and out. And you'll consider this in more detail later on. Now, the three nerves that we've looked at so far, when you look at them physically in the dissecting room, they're actually quite big nerves. However, the fourth cranial nerve, known as the Trochlear Nerve, is actually really quite a small nerve. And this is because it supplies a single muscle which moves the eye. So it's a motor nerve supplying a single muscle which moves the eye, which means that it's only a very, very small diameter nerve. And when you're looking at the trochlear nerve in the dissecting room, it's very, very easy to break it. Why is it called the trochlear nerve? Well, you might recall back from the musculoskeletal module that the term trochlear means pulley. Some bones have features known as trochlear, which are pulleys. And the trochlear nerve supplies a muscle known as superior oblique, which sends its tendon through a fibrous pulley in the orbit. And this gives that muscle a very interesting action. That's why its nerve is called the trochlear nerve. Now, the fifth cranial nerve is a very large nerve indeed. When you're removing the brain, it's very obvious and you have to cut through it in order to remove the brain. And this is known as the trigeminal nerve. Now, the important thing to note in the name is that the word tri means three, and the trigeminal nerve has three major branches, each of which supplies different parts of the head. And the trigeminal nerve is actually a mixed motor and sensory nerve. So it is both sensory and motor. It does not really contain any autonomic components, although some other cranial nerves do hitchhike along the branches of the trigeminal nerve, and that is one way in which we distribute autonomic fibres to the head. But that's more detail than we need to think about for the time being. So the trigeminal nerve, as we've said, is both sensory and motor, and it's sensory to the face. So it's sensory to the face, as well as some of the internal structures of the head, such as the oral mucosa. And the motor component supplies a very specialist group of muscles known as the muscles of mastication. So the motor component supplies the muscles of mastication. These are the chewing muscles. So it's very important if you want to chew to have a trigeminal nerve. And if you look at, for example, the trigeminal nerves of rodents, say of the rat or rabbit, you discover that they have massive trigeminal nerves because they're sending out a whole load of axons to their muscles of mastication, because these animals basically chew all day. The sixth cranial nerve is known as the Abducens Nerve. You might see it occasionally written as the Abducens Nerve. This is another nerve which supplies a single muscle responsible for eye movements. And that single muscle, we're not going to write the name down right now, but that single muscle is called the lateral rectus, and what the lateral rectus does is it abducts the eye. It abducts the eye, moves it away from the midline, hence why that nerve is called the Abducens Nerve. Supplies a single extraocular muscle, so it is a purely motor nerve. Now the seventh cranial nerve is probably the most complex of all 12 of the cranial nerves, and this is known as the facial nerve. Now, don't be fooled by the simple name. The facial nerve has all three components, so it is both a sensory and a motor, as well as an autonomic nerve, and it is distributed quite widely throughout the head. I think for your purposes, the sensory component of the facial nerve can be ignored. It only supplies a very small area of skin around the ear. However, the motor and autonomic components are vital. The motor component of the facial nerve is responsible for supplying the muscles of facial expression. So any muscles that you might use to pull faces with, they're going to be supplied by the facial nerve. And I really want to take this opportunity, and I'm going to be reminding you on multiple occasions in the future, don't get the facial and the trigeminal nerves mixed up. Don't get the facial and trigeminal nerves mixed up. The trigeminal nerve, its motor component supplies muscles of mastication. The facial nerve, its motor component supplies muscles of facial expression. Don't get the two mixed up. Then we also, of course, have the autonomic component of the facial nerve. And as I said, this is very widespread throughout the head. There are more autonomic functions than I can really list here, but I'll give you two major ones. The facial nerve supplies some salivary glands. So some salivary glands are supplied by the facial nerve. And in addition, the facial nerve also supplies the tear glands, otherwise known as the lacrimal glands. So facial nerve has important secretomotor functions, and additionally, just to give you a flavour of the complexity of this nerve, it's also important in taste. But we'll come on to that on another occasion. Now the eighth cranial nerve is the vestibular Cochlear Nerve. The vestibulo-cochlear nerve. Look at the name, vestibule. This is the, some might call it the balancing apparatus of the inner ear. Cochlear, referring to the cochlea, the organ of hearing. So the vestibulo-cochlear nerve is very important for hearing and balance, and it is a sensory nerve. As we said, hearing and balance. Now, if you have damage to the cochlear nerve, one of the things that you can experience is vertigo, which is where it's felt that the room is spinning. And this is because your brain no longer has any relevant information about the position of your head, and this can lead to a sensation of spinning of the room. Now the 9th cranial nerve is called the glosso, for tongue, pharyngeal, for pharynx nerve, the glossopharyngeal nerve. And like the facial nerve, the glossopharyngeal nerve contains all three components. It is sensory, motor, and autonomic. However, in this case, it really is the motor component of the glossopharyngeal nerve which is relatively unimportant. It's only one muscle supplied by the glossopharyngeal nerve. However, it does have vital sensory and autonomic functions. So it is sensory to the pharynx. How do you test that sensory component? Well, if you stimulate the pharynx, say with a probe, you can initiate the gag reflex. So the glossopharyngeal nerve is the afferent sensory arm of the gag reflex because it innervates the wall and the mucosa of the pharynx. The autonomic component of the glossopharyngeal nerve is important for a number of reasons. However, a major one is that the autonomic component supplies the large salivary gland on the side of your face, the parotid gland. So it's the glossopharyngeal nerve which is responsible for stimulating secretion of saliva from the parotid gland. The 10th cranial nerve, and this is one that you may well already be familiar with, is the vagus. Now, it's a little harder to interpret what the word vagus means, but if you think of the word vagabond, for example, someone who wanders around, doesn't really have a home, the vagus is the wandering nerve. That's what it means, the wanderer, and that's because the vagus sends branches not only to the head and neck, but also down to the thorax and all the way down into the abdomen as well. And the vagus, like its neighbour the glossopharyngeal nerve, has all three components: sensory, motor, and autonomic, but it has a relatively small sensory component. The motor component of the vagus, an important function of the motor component of the vagus is to supply the muscles of the pharynx and the soft palate. So this supplies the muscles of the pharynx and the palate. And as I'm sure you're already well aware, it supplies parasympathetic fibres to a whole great area of the body, to the heart, to the gut, to structures in the head and neck. So it's an essential carrier of parasympathetic fibres all over the body. But there's much more going on with the vagus than just that, but I think that's enough to be getting on with. The 11th cranial nerve is known as the accessory nerve, and I like to think of the 11th cranial nerve being called the accessory nerve because we're not quite sure where to put it, and it can be a little bit confusing, and I think that this confusion is caused by the fact that the accessory nerve not only has branches contributing to it coming from the brainstem, but it also has branches contributing to it coming from the spinal cord as well. So it's a bit of a mix. It's got an interesting relationship with the vagus, which you can read about if you like. That's quite an interesting story. But I think for our point of view, what we should restrict ourselves to is the fact that the accessory nerve is a motor nerve, and it really only supplies two muscles as far as you should be concerned: the trapezius and the sternocleidomastoid muscle in the neck. And an easy way to test the accessory nerve is to ask your patient to shrug their shoulders, and that's using the superior part of trapezius in order to do that. So, as I said, the accessory nerve is a very interesting nerve. It has an interesting relationship with its neighbour, the vagus. But from a clinical point of view, in order to test it, one way you can do that is ask your patient to shrug their shoulders. The final cranial nerve is the 12th nerve, the hypoglossal nerve, translating as beneath the tongue. So it runs down into the tongue, and it is a purely motor nerve, and it supplies the intrinsic muscles of the tongue. So this is the nerve which helps us to coordinate the movements of the tongue. And if you think about it, the hypoglossal nerve has to talk very closely to the trigeminal nerve, because the trigeminal nerve, whilst you're chewing, is providing information about the position of your tongue in your mouth, and we need to know that in order to send the tongue to a different place in the mouth, maybe to manipulate the bolus of food. And the hypoglossal and trigeminal nerve need to talk closely to one another, because if they fail to coordinate their activities, that's how you end up biting your tongue when you're chewing. Right, so that's the end of this brief mini tutorial on the basic functions of the cranial nerves. Now, there are many mnemonics that you can learn, which might help you to learn the cranial nerves. I'm not going to provide those to you right at this moment, but you might want to speak to one of your clinical teaching fellows, or go to one of the many websites out there which describe easy aid memoirs for the cranial nerves, because I know it does seem to be a lot of stuff to learn, but at the end of the day you're just going to have to get stuck in, make sure you know at least these basic facts about the cranial nerves before you can then move on to any more detail. Okay, thank you very much. Bye.